Dr. Trapp, hi, welcome. Can we do a quick kind of audio video check with you?
Give us 1 sec. We're getting Dr. Trapp hooked up right now.
Oh, okay, great, thanks.
Okay. Hey, Brad, how's everything going there?
Good, that's great. Your sounds good. Looks all your setup. That's great.
Perfect.
About 10 minutes away, so hang tight. Good afternoon, Corey. Can we do a quick audio video check with you?
Is that good? Test 1, 2, 3.
Yeah,
All right.
yeah, it's loud and clear. You look great. Thanks.
All right.
Thanks for joining us.
Yeah, no problem.
5 minutes away.
Okay.
Thanks. Dr. Ward, can we do a quick audio check with you?
Yeah, hello there. Can you hear me okay?
Yeah, that's good. You look great. Looks good. Thanks so much. Give us just a few minutes away here.
Okay.
Thanks. Jeremy, do you want to do a quick audio check?
Yeah, Brian, can you hear me?
Yep, that's good. Thank you. It's about 2 minutes away. And for media on the call, I've made everyone co-host as much as I can tell, but if I have not made you co-host and you need that ability to record, let me know in the chat.
All right, we're going to get started here in just a minute. For any media partners that haven't, if you're interested in recording, please send a message in the chat to Brian Noonan. He'll get you set up. Okay, I have 2 o'clock. Welcome, everybody, and thank you for joining the Nebraska Hospital Association on our call today. I am Jeremy Nordquist, president of the Nebraska Hospital Association, and this is part of a series of press conferences we've been doing since the first of the year to talk about what's been happening in our hospitals during the Omicron surge and as we come off that peak. And we have 3 great guests with us today. First, I'd just like to start with where we are with numbers. Statewide, we're at 191 hospitalizations. That's the lowest level we've been at in 7 months. We're down about 70% on hospitalizations. over the last month or so. And that's good news, very good news for Nebraskans, for our hospitals, and for our healthcare heroes working on the front lines. But as our hospitals come down off of the peak of the Omicron surge, they face really another mountain of procedures that have been delayed, that Nebraskans have been waiting for. And our guest today will talk about where we are with those. And we as an association, speaking for all of our hospitals, ask Nebraskans to approach this with understanding and patience. Our healthcare heroes have been working on the front line since the Omicron surge and the Delta surge started last July. We've had to delay procedures for months and months, and it's going to take months and months to work our way out of that. So again, asking for patience and understanding from our Nebraskans and family members who are waiting for those procedures. And the staffing challenges we've been talking about over the last couple months, and really during the last year plus, are not going away. Our hospitals still are operating well below where they would like to be staffing levels, and that certainly is compounding the challenges that they're facing and will face over the next few months. Lastly, certainly never want to miss an opportunity to continue to encourage Nebraskans to get fully vaccinated and boosted. We don't know if or when we will face another surge from COVID, but we know that right now less than half of the eligible Nebraskans that are fully boosted or fully vaccinated have gone on to get their booster shot. So that's only about a third of Nebraskans total. And we know that is the best way to prevent hospitalizations in the future. So certainly want to continue to encourage Nebraskans to talk to their medical providers and get fully vaccinated and boosted. So with that, I'll introduce our three hospital leaders here today to talk about what's happening with their institutions and where we are with procedures and the challenges that lie ahead in that space. We have Corey Shaw, Executive Vice President and Chief Operating Officer of Nebraska Medicine, Dr. Carrie Ward, Chief Medical Officer from CHI Health, and then we'll hear from Dr. John Trapp, Chief Medical Officer from Bryan Health in Lincoln. So with that, I'll open it up for Corey to lead off.
Thanks, Jeremy. And, I'm not going to say a lot other than, number one, I wanted to say thanks to the media for taking the time to understand and listen and share some of the experiences that we've had as health systems really over the last couple of years. I mean, the role that we play together and making sure that people are getting accurate information about what's happening in a sea of input, sometimes not the most accurate. It's been really, really important. So I just wanted to start by just saying thanks for your role in making sure that Nebraskans really statewide are getting the best and most accurate information from trusted sources, and that's ultimately you guys. So thanks. As Jeremy highlighted, the last 2 weeks have really been a collective sigh of relief from within our organization among our staff as we've seen those COVID numbers decline, and we know that that's due in large part to Nebraskans embracing those things that we know for a fact reduce hospitalizations, starting with and most importantly, continuing to remain vaccinated and getting boosted on a schedule that fits with those CDC guidance and recommendations. So I want to thank everybody for that. The challenge that we now face, and it's the one that we've been really managing since the beginning of the pandemic, was the two components of our inpatient demand for hospital beds, made up of ebbing and flowing demand for COVID patients that we had very little control over, and then the rest of the patients that we have normally cared for and been there when you need us, that we've had to throttle and limit access for in those instances where COVID was growing at a rate and really challenging our capacity. We're now 1 week away at Nebraska Medicine from being back to what I would consider to be conventional operations. Our main OR at Nebraska Medical Center will go back to what we call our optimal block scheduling model starting next week. So really, since the 1st of January, we've been in a very limited capacity. As you know, we declared crisis and then lived under a directed health measure that denied us the ability to provide a certain level of access, not only in our hospitals, but in our clinics. We've now moved past that. and we're accelerating as best we can, providing as much access as quickly as we can, still prioritizing patients based upon their clinical condition, based upon the judgment of their physician or the physician team, to ensure that we get people in, that we can mitigate the challenges that they may be experiencing within the face of still a very, very busy hospital environment at our 2 facilities here in Omaha.
Thank you. Thanks, Corey. Dr. Ward, please tell us what's happening at CHI.
Yeah, thanks for having us today, Jeremy. I think that you described the situation very well. One thing that was a little different for us, as Corey mentioned, they had the crisis standards, they had the DHM that was limiting some of their surgeries. We have, without a doubt, decreased our inpatient surgeries, particularly those that would require an overnight stay, by hundreds during the peak of all this. But we markedly increased our outpatient surgery, actually, particularly this past year. I think a lot of surgeons and patients have found that there are a lot of procedures, for example, a total joint replacement, that traditionally years ago, all of them stayed in the hospital, sometimes 3 or 4 days. And for the right patient with the right resources at home and the right health, it turns out doing them the same day, getting them home has been a wonderful evolution from all of this. And a lot of patients and doctors have preferred that. So we've increased by thousands, actually, our outpatient procedures. So that's been a good thing. And because, just because of our scope across the state, we've not had, at least right now, we don't have the backlog I think that some systems are dealing with. So we're fortunate that, before this call, I talked to our OR leaders, and for the most part, there are not significant delays for procedures because we were able to continue to do some of these procedures. For the most part, patients can get in when they need to get in. We're down to only 54 patients from hundreds at the peak. We had almost 400 patients in our hospitals with COVID, down a very small number right now. Only 10 patients on ventilators throughout all of our system everywhere. So clearly a different time. However, as Jeremy said, staffing still a challenge. We're still relying on a lot of agencies and travelers, but less and less so. We're confident that nurses are going to start coming back, wanting to work in the hospital. It's a wonderfully rewarding type of medicine to practice, and it was enormously challenging through the peak of COVID. Now that seems to be behind us, at least for the time being, we're confident nurses are going to want to come back and help us not have to rely so much on some of the agency staffing. But those are our challenges right now, getting nurses back in the profession working for us. But otherwise, we're doing there's no delays or cancellations of surgery whatsoever anymore. We're back to business as usual.
Thank you, Dr. Ward. Before I turn it to Dr. Trapp, just for the media, if you have any questions, please go ahead and submit those in the chat, and we'll take those after Dr. Trapp. Go right ahead.
Thanks, Jeremy. So John Trapp, Chief Medical Officer at Bryan. It's been a really amazing 2 years, and particularly since, as you mentioned, last July, the rise of Delta and then the rapid rise of Omicron and drop of Omicron. We've seen cases dramatically drop by 70 to 80% here at Bryan Health. We just have around 30 cases, COVID positive patients, just a few people on ventilators. And of course, that's allowed us to start to open up things like our visitation policy. We've discussed more masking opportunities to allow people to unmask in private offices. And with surgeries, between March of 2020 and the fall of 2021, we delayed 1,200 cases. Now, because of the long delays from July of last year to the current time, some of those cases unfortunately became urgent or emergent as we delayed them. So many of those cases already had to be done. We created a delay for cases that could wait 30 days, but as you know, that 30 days just kept getting extended and extended. So many of those cases were done. And as Kerry Ward said, many cases we were able to push out to outpatient surgical centers, same-day surgery. We were able to continue those cases. And it's amazing how the surgeons and patients were able to adapt in allowing patients to get through surgery same day or even on an outpatient setting. So we've seen that transition. And I think we've learned a lot about how we can manage patients, particularly who are relatively well, who can go through surgical cases. As we look to schedule cases here at Bryan Health, we are slowly opening up our surgical suites to more patients. We're extending our overnight stays, particularly those requiring more than one overnight stay. We anticipate full operations by the beginning of April of this year. We're already seeing a surge in calls to get patients scheduled. Right now, it seems we're able to accommodate that increased number of cases, but I anticipate that for at least weeks and likely months, we're going to see an increased number of patients accessing the hospital system with delayed cases and delayed diagnoses. You know, a lot of procedures like colonoscopy and routine health cancer screening were likely delayed as people did not access the healthcare system. So we'll see what impact those delays of recognition of disease and how that impacts their long-term care, and we'll see how that goes. Many other challenges we look towards the workforce challenge that Carrie mentioned. You know, it not only impacts nursing at Bryan Health, but some of our specialty technicians and additional people, CT, MRI, echo techs, a number of those challenging to get those individuals, as well as how do we get people to return back to work? Remote monitoring remains a topic. How we continue to evolve through this pandemic with the role of telemedicine, I think that will be of great value as we look forward. And I think it's going to be up to the healthcare system leaders to determine how we come out of this pandemic and what we can do to continue to collaborate together. We've seen that in Nebraska as the healthcare systems have done more discussions and presentations and communication to the media, to the public, and with each other than has been seen perhaps in a number of years. I think that's really an exciting time that how we can collaborate together and work together. The source of truth that Corey mentioned, I think that's really important that we become the voice of perhaps what makes sense and the voice of truth. I think that's really important that we continue to come from that background, that we provide that voice out. And I hope to see that continue looking forward. Thank you.
Absolutely. Well, thank you, all three of you, for your comments. Any questions from the media? We have nothing in the chat right now. Anyone have any questions? There we go. First question from Matt. Do you foresee the dropping of masks anytime soon for staff, patients, and visitors? Who wants to take that one on, Dr. Trapp?
Yeah, that's really challenging. We're looking at, right now we require masking for our visitors. And the main thing that I think the public needs to recognize is that we have a vulnerable population within our hospital walls, those who may not have as strong of an immune system, and we need to protect those individuals the best that we can. And having their healthcare course complicated by a secondary course of COVID may not result in the outcome that we like. So right now we're going to continue masking for visitors. We ideally keep our patients masked if possible. And then staff, certainly in any public areas or patient-facing areas, we're going to continue masking. And we're simply going to monitor and see how things go over the next few weeks and make decisions as time goes on.
I'd say the very same. I agree 100% with everything he said. You know, if you look at some of the county websites like Douglas County, you know, it's still in the substantial transmission category. So, you know, still more than 50 cases per 100,000 and until it gets significantly lower than that, we're not going to change our mask policy for hospitals.
Yep. We're in the same boat. When you come to a healthcare setting, clinic, hospital, whatever, you expect to be safe. And candidly, right now, with the way the Omicron variant in particular spreads and what we don't know about the future is, still up for grabs. But you don't know if you're shedding virus, and we know that one of the ways to help diminish the potential for you to be expose somebody else or be exposed is to wear that mask. And so we'll continue doing that in order to keep our workforce intact and also make sure that patients and visitors are protected as well as they can be in an environment where we know there are sick people to begin with.
And some of you addressed this in your remarks. This is from Josh Funk. You partially addressed this. How far away from quote unquote normal operations are you? What is delaying that given the low COVID numbers? Is it primarily a matter of the backlog of procedures?
I can jump in and start. I think number one, understand for every COVID patient that's not in the hospital today, we've replaced it with another adult patient that needed to get care. And so with those delayed surgical cases that we experienced that required an overnight stay, we've accelerated our activity in those spaces as the COVID volume has decreased. And so we've essentially swapped one patient for another, which is exactly what we want to do to make sure we're using all those resources as optimally as we can. The other thing to remember, and I think Carrie made this comment, is we're still dealing with, in many instances, a shortage of labor, and in particular RNs, but also certified nursing assistants, as well as the technicians that support care across really the entirety of our healthcare system. And the availability of labor, whether it's driven by a demand from COVID patients or all of the work that we do as health systems, is going to be a rate limiter going forward. And it's just going to be a reality. We're all working very hard to redesign the way we deliver care, use technology more effectively, but that takes time. And so in the meantime, we'll have to meter what we do clinically in terms of access based upon the number of staff that we have available.
Dr. Trapp.
Yeah, we were able to close down or disassemble our COVID units. So we're at fairly normal operations from an inpatient perspective. As Corey mentioned, the hospital beds have remained full. The exciting part, we've been able to accept transfers from some of our critical access hospitals. That's been a big relief off of them, that they don't have to manage some of these more complex patients, and more people are able to access care. So hospital census has remained full. We continue to unfold our surgical operations. Again, I mentioned April 1st, we should be at full operations. But what is new normal? It's still in the differential diagnosis. Every time you see a patient, even an inpatient, develops a new fever, you have to consider, could this be COVID, and what isolation is necessary? So it has impacted our ongoing care of patients, both in the inpatient and outpatient. So we'll see what the new normal develops. But as far as hospital beds, they are filled. We are continuing to provide that care to all patients across the community and across the state. We're excited to do that. As was mentioned earlier, almost a sigh of relief over the last few weeks as we've been able to take care of patients with what we might consider normal diagnoses that result in hospitalization. Excited to be able to send those patients home. And at Bryan, we're really excited to have more support, visitors, family coming into our hospital to enhance that communication between the doctors and nurses and the patients. That's been really important, and something that's been missing throughout much of this pandemic that we've just not been able to do as well with use of Zoom or other telecommunications.
Yeah, I wanted to add to that, and then I just saw Matt Overding asked a question related to this. I was talking this weekend with some critical care doctors, and Dr. Trapp, being a critical care doctor, certainly knows a few specialties have been more taxed than our ICU nurses, our ICU doctors, and for them to be literally, seeing half the volumes that they were, it is such a sense of the stress level is so much lower for our staff, not having to care for all these people. So it does feel like a new day. But there was a time just a few weeks ago, even, we get a list every day, like everyone on this call does, of all the critical access hospitals that are trying to transfer patients to us. And there were days that there were 30 plus patients waiting around our state to try to get in. And it was terrible for all of us to not be able to have room for these patients. And critical access hospitals sure stepped up for this. But now we are not denying anybody. I get the last several 10 days at least, we've not had one denial from a critical access hospital. And I think that probably all of us now, we're at a point where we can now take these patients, right? We're able to take not any transfer that wants to come our way right now, just like surgery.
I think the other thing, and Carrie and John both mentioned things that we changed and are likely to retain as a result of our experiences in the last 2 years, is this one thing. I think regional healthcare facilities, critical access hospitals, have grown more comfortable taking care of patients that maybe prior to the pandemic they would have reflexively sent along in order to try and provide a higher level of care. And in reality, I think between the work that we've all done to extend through virtual outreach, more access to specialists locally, it's allowing families and patients to stay closer to home. And I think candidly, as we look to the future, I know it's something we're thinking long and hard about. diminishing really the requirements and need for people to come to one of our facilities, and to the extent we can support them and remain cared for closer to home, everyone's going to be better off. And then we can really preserve those facilities that we have within our system for the patients that absolutely need it or really can't be transferred someplace else.
That's a great point. As I've toured some of our hospitals around the state, especially our critical access hospitals, I've heard a lot of stories of the trauma and the pain that those healthcare heroes have gone through, but really kind of the uplifting stories about they've done more than they thought they ever could. And I think a lot of those hospitals are thinking about how to continue to advance how they serve Nebraskans in rural communities. So something I think collectively as hospitals will be looking at. The last question we have in here is, how is the ability to move to have more visitors, has that cut down on the incidents with patients or their families, kind of the challenges with the interactions with patients and families recently?
Well, I can, John.
Corey, you want to go?
Go, no, John, go ahead. Go ahead.
I think the importance is it's really enhanced the communication that we've been able to have with patients and their families. For patients to be able to lay eyes on their loved ones in the hospital, that really helps to promote the understanding, makes for better decision-making, enhances communication, and really just does create a more collaborative healthcare experience for everybody. So, I think we're always going to have incidents from time to time where there's perhaps disagreement, but this has been really enhanced communication, and that's probably where I'd go from there.
Yeah, I would agree with that. I guess what I was going to say is, unfortunately, this is a reality that every healthcare professional that works in a clinical setting faces, that maybe is probably underappreciated outside of inside baseball, if you will. Healthcare workers are among the most frequently assaulted profession in the country. That may sound odd. Some of that's because patients are delirious and they have challenges. They're not accountable for what they're doing. But sadly, in the last 2 to 3 years, and I think there's a greater awareness now than there's ever been, that whether it's frustrations with the system, frustrations that people are dealing with outside the home or outside the hospital, that we've seen a significant increase in assaults on our healthcare professionals. And that's something that we're going to have to address as a society, candidly. One that we're spending quite a bit of time talking about here. We just spent quite a bit of time with our colleagues health system wide talking about de-escalation strategies and tactics, working to enhance levels of security to ensure that both patients and caregivers have the space and the safety to be able to care for patients in a way that we all would want to be cared for if we were in a hospital setting. It's a challenge that we're going to have to continue to address as an industry.
Yeah, I appreciate you saying that, Corey. I agree 100% with what he said. It was a little bit of a contentious issue about visitors. We decided early in this to allow visitors to continue to come in. And right or wrong, we all recognize the enormous importance of for the visitor, for the patient, for them to come. But there are risks associated with that. And all I just ask to add to what's been said by others is, please respect. I know that we are seeing increasing numbers of visitors come in not wanting to wear masks, not wearing masks. Please respect our policy. And as Dr. Trapp said, these are vulnerable patients, and there are cases around the country of patients getting COVID while they're in the hospital, and we cannot have them exposed to that. So please follow the rules, because we do recognize the importance of that. We want the visitors to be able to come in. We want our patients to be able to have their family and their friends visit them. But please respect our rules.
Well said. Well said. Well, we appreciate all three of your time today and sharing what's happening at your hospitals with the media. Appreciate our media partners joining. And as always, if any of our media partners have questions and want to follow up with any of our hospitals on today or other hospitals in the state, feel free to reach out to us at the Hospital Association. Thank you all.
Thanks.
Thank you.
Thanks, guys.